Hi there, I'm Natalie, and I'm here to show you how to wrap your first surgery pack. First, before getting started, let's gather our materials. You'll need the surgery pack description guide, fenestrated drape, a large 2-ply wrap, base towel, sterilization strip, 3x3 gauze sponges, autoclave tape, and surgical instruments. The surgery pack description guide has everything that you will need to wrap this pack. The fenestrated drape is the drape that will contain the sterile field for our surgery. A 2-ply wrap is what will house our entire surgery pack at the end. This just has 2 layers of cloth between it. This particular one is a large. The base towel will house the secondary or primary surgery pack. This is quite long, so we will shorten this up, but we will get to that a little bit later. Next is the sterilization strip. This will tell us that our pack is sterilized from top to bottom. And then our 3x3 gauze sponges. Your description guide may say 4x4s, but 3x3s will do. And then last but not least, the autoclave tape. This is special tape that tells us that our pack is sterilized. It contains lines that turn black, so this is not medical tape. Now let's get wrapping. First, we have our large 2-ply wrap here. We want to orientate it in a way that is best fitting for wrapping. So we're going to put this into a diamond when facing yourself. Next, we'll have our base towel. We will spread this out. As I said, we're going to try and make this a little bit shorter, so we want it as close to a square as possible. It's kind of impossible, but we're going to make it a little bit longer than a basic square, and then orientate that into a diamond. Next, we're going to take our description guide, if you need it at this point, but ultimately we are going to sort through our surgical instruments. So you want to try and group your instruments that are similar. Some may look similar but are different instruments, so just be careful. Don't worry about knowing what your surgical instruments are called. In order to wrap a pack, you genuinely don't necessarily need to know what the instruments are. Having said that, at some point you may want to, but in case, we do have a description guide similar to the pack description, but this has pictures to show you the difference of each individual instrument. And this is to help you move along. If you'd like other options, I can provide you with information on how to differentiate and how to work on this at home. But in the meantime, let's just group everything that's very similar and make sure that we are not missing anything. If we do miss things, please notify someone who does know their instruments, and we can find an alternative method. So ideally, we don't want to go without certain instruments within a pack. Okay, so let's finish up here, and we will move forward with the next step. So now that we've completed sorting our instruments, let's make sure that we have everything that we need in this pack according to the description guide. So first we have the spay hook, then the spay clamp, needle drivers or needle holders, 2 Rochester Carmalts, 2 Alice tissue forceps, 4 straight hemostats, 3 curved hemostats. It does not matter which kind, cryo or Kelly. 2 scissors. These are 2 different types of scissors. 4 towel clamps. And I think I forgot the 2 thumb forceps. Those are 2 different ones. And then our sterilization strip, it magically appears. We want our 3x3 gauze sponges. Now there is always debate on how many to put in your pack. Usually 20 to 30 is plenty. Ideally you want enough for a large surgery like a foreign body procedure or even an amputation. That's the most ideal. Then we have our fenestrated drapes folded. This is a large small, and this is a large large. Some have labels, some don't. So knowing what those look like is ideal. So that's a large small, and that's what's going to go in this pack today. If you'd like to learn how to fold a fenestrated drape, there is a separate video. Now, next we will order our utensils or instruments into a fashion that is largest to smallest. Now you'll see that I'll put the needle holders in the back. That's just personal preference. A lot of doctors want to get those out pretty early. So same thing with scissors, but ideally largest to smallest is great. Hemostats, they can be a little different. That's a curved one. It's really tall, so I'm going to put my straight ones underneath that because they're a little shorter. Now I'm debating whether or not to put the straight ones or the curved mosquitoes. I'm going to do straight first and then the curved. They just tend to fit better in the pack. So we want to make sure that our surgery tools are kept open. Do not lock any of them. Next we will put the thumb forceps through the top finger hole of all of our tools. So this can take some finesse, so just be patient. And then we'll take the other thumb forceps and make it opposite into the same hole. So now we want to make sure that we got all of our utensils, thumb or finger holes inside there, which in this case I did not. So I will restart and manipulate them in a way that I can best fit that. So we'll redo that real quick. And then next we will take our scalpel handle and we'll place that in the bottom finger holes of all of the utensils. This is to keep the utensils together, and so they're not flying all over the place in your pack. You'll put your spay hook at the bottom and then fan out your utensils a little bit and try to get them as flat as possible. It's not ideal. You won't get them completely flat. Place your towel clamps on top, and then your sterilization strip will go right down the middle of all of your utensils. This is to make sure that all of your utensils get sterilized. Next we will put our gauze on top of that, and then at the tippy top we'll put our drape, the large small drape. Next we're going to start wrapping. This is ideal that you get this pretty tight. You do not want a loose pack. In this case we want to pull the tab back and then try to hold your hand down on the tightness, and then you're going to pull this bottom flap up and then tab, and then take the top flap, pull it towards you, fold this towards you, and then tab, and then pull this right flap, pull it real tight, and then we're going to tuck this tab underneath all of those flaps. Now leave a little bit out. Now give me a second and I will actually do it in this video. So here's our tab, leave a little bit out, and we want to make sure that the tab is actually facing us, so our body. And then we're going to fold it just like we did before with the wrap. So we're going to pull it tight, bottom section, straighten all of this out. If you're a neat freak like me, that's what I like. And then pull the tab back, and then set it on top. Next, well, I'm a righty, so I always take the right side and I pull it tight across my pack and then pull back on a tab. And then the left, same thing, pull tight, straighten out things, and then make a tab. And then finally pull the top one, pull it back towards you. I like to turn my pack and then I can tuck in the tab right there. It's just easier. Leave a little bit of tab and then we're going to place our tape. So I like to tab my tape, it's just easier to pull it off when I need to open the pack. So we'll put across both sides, half to half is ideal. You don't need a ton, but you need enough to hold your pack together. Next we're going to label our pack. So we're going to look at our surgery pack description guide again, and it's going to tell us what our title should be. So in this case, this is the orange-green general pack. We do also have some mini packs and an eye pack. There are several different types that require different labeling. So in this case, this is a general pack. Next, we want to list the drape size. So in this case, this is a large, small. We're going to use the least amount of wording possible to get the point across. And then next, we're going to do our scalpel handle. I'm only going to put the number. In this case, this was a number 4 scalpel handle. And then make sure you place your initials so we know who wrapped the pack, and then the date. And this is going to tell us what day this was wrapped, but also when it was autoclaved. So, next step is to keep practicing. Does anybody have any questions? Thank you so much.